Welcome back. It's 10 minutes past 8 Central African time, and you tuned into News and Views with myself, Salailo Makudir. We're going to be kickstarting the show with a very, very concerning development. A new report by the South African Human Rights Commission paints a deeply troubling picture of sewage pollution in parts of the Eastern Cape, with communities being exposed to serious health and environmental risks. So we're going to be jumping
broad that were tested, and from those tests, there were some serious findings in terms of especially the outlet at the West Bank sewage treatment facility. That there was over 900% the treated effluent, 900% over what should have been the acceptable norm. So I mean, and then there's various other rivers that at the time of the testing, they seemed to be fine. But then what we then did was we also called for submissions from the various municipalities, indicating what our findings were. And then one of the municipalities actually showed us they tested a specific few rivers twice, March and then in April. The March's findings from their side had found that the E. coli levels, the coliform levels, etc., were within range. But then the April test results showed an extreme increase, which extended beyond the acceptable norms. So it just shows that even though the river may not be contaminated on this particular day, doesn't necessarily mean that tomorrow it may not. It's not isolated. It's an ongoing crisis. So that's what we found in our report. And then that's obviously what led to our recommendations.
I want to take a quick break, but when we come back, I want to focus on some of those recommendations and also the fact that the report raises, I think, some serious concerns about human dignity and the rights that are being infringed on the people that are living around those areas. I want to touch on that and how are humans on a day-to-day basis are being affected by this crisis, but we'll do that after this short break.
You know, it's a wonder how kids get anything done these days. With all the distractions, when do they even get time to study? As a mother, all I can really do is make sure they have all they need to perform at their best. That's why I choose to include Sunfoil, triple refined pure sunflower oil with every meal I make. Naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether I'm cooking, frying or baking, I know every dish will be a wholesome one. Sunfoil, now we're cooking.
Right now, over 150 million children around the world are orphaned, facing hunger, hardship, and uncertainty. With Islamic Relief's Orphan Sponsorship Program, you can provide a child with access to education, nutritious food, essential healthcare, and a safe home. Your sponsorship is not just support, it's hope, security, and a brighter future. Be the reason an orphan child smiles again. Sponsor an orphan today with Islamic Relief.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
Are you banking with convenience, transparency, and flexibility? With Al Baraka Bank's transactional banking account, you can enjoy convenient everyday banking designed around your needs. Benefit from zero fees on point-of-sale transactions and manage your banking easily through Al Baraka's secure mobile banking app and internet banking platform. From everyday payments to managing your personal or business banking, Al Baraka makes banking simple, transparent, and convenient. Visit albaraka.co.za to learn more. Al Baraka, your partner bank. Al Baraka Bank Limited is an authorized financial services and credit provider.
Rejuvenating media day by day. This is Salam Media.
Welcome back. You're still tuned in to News and Views with myself, Salailo Makwidire. And we're still looking at a very, very concerning reality here. And I think this is very, very important, especially because we're leading up to the local government elections. We're in conversation with Brandon from the South African Human Rights Commission. And there's a report which laid bare the scale of sewage flowing through streets near homes and into rivers in many communities around the Eastern Cape. And Brandon, thank you so much for for staying with us. Before we went on to that short break, I wanted to chat about what communities are dealing with on a daily basis. How are people being affected, the residents who've been living under these conditions? And also the report itself, I think, raises very, very important questions about human dignity and the right to a healthy environment, and how are some of those rights being affected, and some of the recourse, some of the remedial actions that the South African Human Rights Commission has on that report.
Yes, no, thank you. No, definitely your Section 10 right, which is human dignity, is meant to be upheld. Your Section 24 rights, which is the right to a healthy environment, is also meant to be upheld. And definitely, when we went during our investigation, we definitely found that the communities that lived nearby the Kwanomza treatment facility is in Humansdorp, their rights were extremely violated, because during my inspection, I noticed there were two inspections that I conducted. The first inspection, I actually went around with the complainant to the treatment facility and also close to the community, where the community literally live about 100 meters away. And you can actually see the sewage, the untreated sewage, flowing nearby near their homes, their residence. And also, you must also not forget that there's children. There's children that's playing in the streets, soccer, walking around, and yeah, we have untreated sewage close to them, nearby, and definitely a health concern and an impairment to their dignity. So definitely. And then you've also got your fauna and flora. So your right to environment will include your one has the right to a healthy and safe, healthy environment, but then your fauna and flora get affected. Your marine life gets affected. Your aquatic life gets affected. And then in the Sequoia River, we also have persons that fish for business, fish for the purposes of selling their fish or for the homes. And then during the inspection, one of the riverines that led into the Sequoia River, myself and the complainant, we actually noticed that there were dead fish laying on either side of the river. Now, whether that was as a result of the untreated sewage, I would guess that more than likely it was, because it wasn't only him that said that. Even the farmers themselves said that they had noticed that even their cattle were getting sick, etc. So definitely your Section 10, your Section 24, your Section 27 rights were definitely infringed. And then our recommendations, we went on to say that we need to start from because in some of the responses over the years, we've received responses that speaks to personnel constraints, that speak to budgetary constraints, that also speak to vandalism, sabotage. That's also been a response from various other municipalities around the Eastern Cape, where we have found that the treatment facility is non-operational, therefore leading to effluent flowing in the streets and amongst the community homes. So our recommendations included in it to rope in SAPs, bring in SAPs, the South African Police Services, employ security personnel. But then again, employing security personnel is also it's a weight on their budget. So our recommendations included just start to ramp up maintenance, to start to ramp up securing the facility, start to ramp up on bringing the correct chemicals, because we also found that there were not enough chemicals to treat the effluent. Then they also need to ramp up monitoring, because a lot of the times that these municipalities were not monitoring at the site where the effluent leaves the actual facility, and then also downstream where the outlet meets the river, or where the river meets the ocean. So there were a good couple of recommendations where we also there was also a question about accountability. It's not for us to to hold any municipality or directorate accountable. For us, is to ensure that these municipalities take steps to secure redress. So that's where we wrote in the Department of Water and Sanitation, because in terms of their mandate objectives, they have the mandate to hold these respective directorates or municipalities accountable by issuing out a notice. If that notice is not complied with, then they go according to their act.
I want to come back to the municipalities themselves, because as I mentioned, we're heading over to the local government elections later on in the year. From what you've gathered in this report, what would you say is the primary issue here? Is the issue infrastructure, or does it point to failures in governance and maintenance in general?
Good question. I would say it could be a combination of both, because if there are alleged failures by officials, then in order to maintain and ensure that the treatment facility operates properly, then that in itself would lead to a treatment facility that doesn't operate at full capacity. I know we are a Chapter 9 institution. We are independent. We act without fear, favor, or prejudice. So there have been questions on the sidelines, in the corridors, to say, why are we releasing this report now? There was one of the municipalities that actually wanted us not to include them within the report next to the other two municipalities, because it will shed a bad light on the one municipality. So I'm not going to name names, but we are independent. We act without fear, favor, or prejudice. Our aims are to ensure that the people, the environment, is protected, is their rights are upheld. We can't wait for a couple of months to go by without issuing the report. So yeah. But other than that, I know there are definitely nuances in terms of politics, whether the report will be used for political means, but that's not in the back of our minds. We are here to do work. We are here to protect people's human rights.
The commission itself has come under a lot of criticism, specifically because many claim that some of these reports and investigations that you guys gather ultimately don't lead to any kind of meaningful action. The remedial actions that you guys suggest or have on the reports are not followed through. How will the commission ensure that this report does not simply become another document without any tangible, meaningful action, especially for communities that are affected?
That's an excellent question. And I know with the recent news in the Concord, our case in AgriData, made reference that the fact that the commission's findings or recommendations are not binding. But that does not mean that us or anyone else can actually take our report and use it in the courts. Because if I may just go off tangent off the topic, I'll just give you a reference to two reports. We prepared a report, the annual Benny report, where the 21 youth passed away at the annual Benny Tavern a few years back. That report, we made findings and recommendations, and that report was used in the inquest to determine the cause of the death. Another example is against the Department of Health. We had a report against the Department of Health in terms of emergency medical services reaching marginalized and poor areas. That had no 4x4 vehicles in that. So we actually prepared a report. We issued the report out. It wasn't complied with. And then our office took the report to the High Court. And we eventually from that got a judgment against the Department of Health, where it said that within X number of days, the Department of Health needs to secure proper vehicles and also needs to provide logistics between the clinic and a district hospital. So the same in this instance. These municipalities have got X number of days to respond with plans on plans on what they intend to do and implement to ensure that the treatment facility plants become operational. Not overnight, but to ensure that there's steps taken to ensure that the treatment facility plant is maintained, is fully operational, that there's monitoring activities that are undertaken within every 2 weeks or 30 days, and that all those plans and those monitoring results, the assessments, are provided to the Commission. So after that, internally, we'll peruse these responses, and if the responses are not adequate, what we'll then do is we'll write back to the municipality, give them 7 days to provide us with a proper response. And then during this process, we might have high-level stakeholder engagements between us and the Premier's office, or us and Kochta, or us and the Department of Water and Sanitation. But eventually, we do have the power to actually take this to court. So people must not forget that. Yes, our findings and recommendations are not binding, but that doesn't mean that we still can't approach the court and ensure that those recommendations are enforced legally through the courts.
There we go, Brandon Ainslie, legal officer at the South Africa Human Rights Commission out in the Eastern Cape. Thank you so much for joining us. Really appreciate it.
Thank you. Thank you, sir. Thank you. Thank you to your audience. Take care.
There we go. And with that, we're going to take a quick break. We'll be back with you after this.